Well, thank you very much for having me. I'm so inspired by all the former speakers this morning. And I just wanted to share with you, I'm faculty of the School of Nursing, and we try to inspire leaders in students as nurses to go out into the world and to make change. So I just wanted to share with you this morning a model that we have come from providing clinical care. Many nursing schools send students abroad to do clinical care, but over the years we've discovered that we bring large groups into small communities. There's lots of projects going on. There's lots of disruption. Families are disrupted from going to work. They're waiting in long lines for brief episodic clinical care. There's no education from us involved, and limited sustainability. So what are we doing there for such a short period of time? So we did some surveys, and we looked at some of our data, and we found over the years that all the pediatric visits that we had seen in this small rural community in Nicaragua, they were all visits for headaches and belly aches and things that the Health Post team, which is a government-sponsored organization in the community, they could really do all of those things that we were doing and that the people were waiting to see us for. So we were concerned that we were devaluing the role of the local health providers. And we didn't feel that our presence in that community had any long-term impact when we were just doing brief clinical care. So we kind of put our heads together, the faculty and the students that had gone, and we tried to figure out some means to be more respectful to the community leaders, to the community healthcare providers, community residents, and how to be more effective in improving their health over time. So we decided that we would go down and do focus groups to the community. And I just came back last night from our second focus group. So we met with different groups of people in the community. We met with the brigadistas, who are the community health workers. We met with a health team from the Health Post, who are employed by the Ministry of Health, which is a government organization. And they have an RN and a physician there. So it's a very, very wonderful community to work in because you can make some changes among the people there. We met with the teachers. As many of you have said, it's so important for teachers to keep kids in school, to do preschool through high school programs. We met with women, we met with a separate group of men, and a separate group of adolescent boys and girls. And we figured out from their conversations with us what they wanted to learn. We told them we were not doing clinical care, but we just asked them what they wanted to learn. And each group had very, very specific things that they wanted us to come back with students and to teach them. So we did that. We selected students very carefully when we were here back in the U.S., and it was a group of nursing students, family nurse practitioners, pediatric nurse practitioners, nurse midwives, acute care nurse practitioners. They worked in teams. They researched the topics that the community was interested in learning about. They developed materials. Some of them were original materials developed here. Others were materials that we used from World Health Organization and other organizations that were kind of very concise. And we learned a lot about the students learned a lot about the culture, the cultural practices in the community, and we took as many Spanish-speaking students as we could because that's very important. So on the ground work in Nicaragua with students last spring, we engaged local nursing students, Nicaraguan nursing students, which was the best thing that we have done. They bonded tremendously well with our nursing students, and yet it was so much more powerful for the community residents to hear these things from local nurses rather than from outsiders. So we had local post people, local health post team, the nursing students from the U.S. and the nursing students from Nicaragua. And the topics were identified. The women had certain topics of health they wanted talked about. Very many groups wanted to talk about domestic violence, how to talk to your children, how to keep your kids off of drugs, how to keep your kids in school, many of the issues that we've heard about today. Mental health was a huge issue that they wanted. So this is a picture of the nursing, this is the central person is a nursing student who developed this adolescent program that went over 3 days when we were there. And then she just came back. She was there for the summer. She was awarded a Downs Fellowship for the School of Public Health here, and she had spent 10 weeks with these adolescent groups and helping them to learn to develop their self-esteem, self-respect, respect for others, good decision-making, reproductive health, careers, goal setting, all of those kinds of things. So those are the things that we will continue. So these are the participants last year. We had 61 adolescents in that 3-day program, lots of men and women. And we surveyed them all afterwards, and they were all very, very pleased to have more hands-on skills. We taught first aid, we taught blood pressure taking so that they could help the health post nurse monitor the blood pressure throughout this huge community. Women learned about health, self-breast exams, menstrual, menopause, all those kinds of things. We had, this year we're bringing a mental health person with us who can provide some more services. We have an early childhood project engaging the parents and the brigadistas in kind of forming those attachments between mothers and babies with books and simple toys that we can make in the community. So hopefully all of these educational efforts are more capacity building and will be more long-term than the short week or 2 weeks that we're there each year. So that's just our model of care. We learn to go into a community with humility, learning what they wanted to learn, not what we thought they needed to learn. Building relationships with the Health Post team is critical. This is the one of our students, and this is the Health Post doctor. Capacity building, that is critical, so this work can go on while we're not there, and they can develop things themselves, identify their own needs. Reciprocity among the nursing students from Nicaragua, and continuity. We came home yesterday, and we'll go back in March with plans based on what we identified this week. Okay, thank you very much.